Welcome to our PowerPoint presentation on sickle cell disease. This presentation was constructed by Manisha, Nicole, Stephanie, and Lucy. Sickle cell anemia, or sickle cell disease, is a commonly inherited blood disease affecting a majority of African Americans and the African community. An estimated number of 90,000 to 100,000 Americans are diagnosed with the disease, with 1 in 500 African American births diagnosed with sickle cell anemia. Approximately 2,000 babies are born with sickle cell disease each year in the United States. These abnormal cells are distorted into a sickle cell and are fragile, prone to rupture, resulting in much pain. Due to the shape and size of the abnormal cell shape, the blood cell is unable to move into tight spaces, risking the result of blood clots and organ damage. Hemoglobin is the protein within the red blood cells that carry oxygen. Sickle cell anemia is an inherited blood disorder due to abnormal hemoglobin cells. Patients with sickle cell anemia must inherit 2 abnormal genes to make hemoglobin S, and the patient must have 2 hemoglobin S genes to have the diagnosis of sickle cell anemia. The mutated hemoglobin B leads to the synthesis of hemoglobin S, which polymerizes when deoxygenated and becomes distorted, causing injury to red blood cells. Some of the symptoms associated with sickle cell disease are fatigue, shortness of breath, dizziness, headaches, cold hands or feet, pale skin, chest pain. Patients diagnosed with the disease are homozygous and carry the gene for the mutation, once inherited. They have 2 identical alleles for carrying a trait from each parent. These patients suffer from acute vaso-occlusive disorders, hemolytic anemia, organ damage and failure, and reduction in lifespan. A heterozygous patient is a carrier of the sickle cell trait, but only carries one, and is asymptomatic. Being a carrier does not mean that they have the disease, because they need 2 alleles in order to be symptomatic. However, if their spouse has the trait, there is a chance the disease can be passed on to their offspring. Sickle cell is prevalent in the African American population within the United States. In the United States, sickle cell disease occurs in approximately 1 in 400 African Americans, 1 in 1,400 to 1 in 36,000 Hispanics, 1 in 80,000 whites. Also 1 in 12 African Americans have the sickle cell trait. 20-30% of children with sickle cell disease experience stroke and cognitive impairment. The mutated hemoglobin reached polymorphic frequency in the areas of Africa, and other genes were noted in the Middle East and India, the subcontinent where malaria was prevalent. The malaria carriers have advantage in survival and were able to survive and reproduce. Sickle cell disease has a huge impact on families. Individuals with sickle cell disease and their families are faced with several potential difficulties that are dependent on the severity of their illness, access to medical treatment, family variables, treatment adherence, and psychosocial adjustment. Sickle cell disease can be disruptive and is stressful for the entire family. Caregivers express that both they and their families feel burdened financially, emotionally, and with respect to time and convenience. Caregivers experience significant distress due to interfamily burdens such as increased conflicts, difficulties managing children, and family members with emotional problems. Sickle cell disease can also be detrimental to the marriage. Couples find it difficult to take care of themselves and their marriage when they are balancing being a caregiver with the demands of family life. Sickle cell disease severity has negatively influenced the quality of life of parents who have children with sickle cell disease. Parents that have children with chronic illnesses report living worried. They worry about the judgment they will receive from others on their management of the disease. Parents worry about their family and the future of their child with the disease. Parents feel guilty for giving their child the disease and often blame themselves for their child's suffering. Parents grieve the lost dream of a healthy child. The demands of caring for a sick child can cause severe strain on a marriage and results in less time spent together. Siblings of children with chronic illnesses are at risk for negative psychological effects. Some families rely on the sibling to entertain or assist in the care of the child with a disability. This puts stress on the siblings. A study conducted by Atago and Curtail found that about 40% of the caregivers sometimes or frequently neglected other members of the family because of the demands associated with the child's disease. Social support is related to behavioral and psychosocial adjustment of the healthy sibling. A study conducted by Gold et al. Found that the number of emergency room visits was associated with sibling adjustment, with a greater number of ER visits leading to poor adjustment of the healthy sibling. ER visits can lead to family disruptions and separations resulting in sibling distress. Gold et al. Found a significant negative effect existed for siblings of children with a chronic illness relative to normative data. Psychological functioning, peer activities, and cognitive development were lower for siblings of children with a chronic illness. The healthy siblings' knowledge about the illness was related to their behavioral and psychosocial adjustment. Kokinen et al. Described 7 feelings of siblings of children with chronic illnesses as feelings of guilt about having caused the illness or being spared the condition, pressure to be the good child and protect parents from further distress, feelings of resentment when their sibling with special needs receives more attention, feelings of loss and isolation, shame related to embarrassment about their siblings' appearance or behavior, guilt about their own abilities and success, frustration with increased responsibilities and caregiving demands. Sickle cell disease has detrimental effects on the family income. African American children are more likely to live in poverty and reside in families with lower family income in the United States, with 27.4% of African Americans are living in poverty. Low family income is associated with worse total health-related quality of life for children with sickle cell disease. Adults with sickle cell disease and those with children affected by the disorder may miss days of work due to exacerbations and hospitalizations, which can severely impact their finances. Kof et al. Conducted a study that found total health care costs ranged from $892 to $2,562 per patient per month. The cost of health care rose with age. Patients with sickle cell disease and their families need support, especially during a crisis and/or hospitalization. Support can be obtained from other family members or the community. According to Kokinen et al., social support can be categorized into 4 categories. Emotional. This can be obtained from family, friends, or the healthcare team. Instrumental. A neighbor mowing the lawn for a family while their child is hospitalized with a sickling episode is a form of instrumental support. A fiend recommending a website that provides information on sickle cell disease is a form of informational support. Appraisal. The physician giving feedback on how the family is doing with preventing sickle cell crisis is an example of appraisal support. Family therapy can be beneficial for the individual with sickle cell disease and their family. Family therapy that focuses on preventing exacerbations of illness. Behavioral family therapy and parent training to optimize family coping. The importance of social support. Promoting expressiveness and resolving family conflict will result in better coping for the entire family. Crisis intervention counseling for siblings that allows the siblings to ask questions and gain a better understanding of critical events. The husband and wife relationship also needs to be an area of focus because children need a stable family. Kokinen et al. Reports that a strong husband-wife relationship is important. Ways of promoting a strong husband-wife relationship are spending time together. For example, a date night. Open communication between the couple. Balancing roles and responsibilities by dividing responsibilities to avoid caregiver strain. Taking time away. Parents can utilize other family members or respite care services so they can focus attention on caring for themselves. Genetic counseling can also be beneficial for families affected by sickle cell disease. Sickle cell disease is inherited in an autosomal recessive manner. The offspring must have changes in both copies of their hemoglobin gene to have sickle cell disease. When both parents are carriers, there is a 25% chance the offspring will have sickle cell disease, and a 50% chance that the offspring will be a carrier, and a 25% chance the offspring will have 2 normal genes. Genetic testing can be done by obtaining a blood sample and looking at the DNA for changes in genes that cause sickle cell disease. Genetic testing allows couples to make informed decisions about reproduction. Joining a group with other individuals with sickle cell disease can allow the patient and family to see that others go through similar experiences and learn new ways of coping. Support groups allow the individual and family to feel less isolated by offering an opportunity to bond with others affected by similar issues. Group members can exchange resources. Support groups facilitate the family's ability to acquire emotional, instrumental, informational, and appraisal support. There are many resources available for individuals with sickle cell disease and their families. Sickle cell disease can have detrimental effects on the community. In 2004, 83,149 adults were hospitalized with sickle cell disease, with a total hospital costs equaling $418 million. Among those hospitalizations, 66% were paid for by Medicaid and 13% by Medicare. The total healthcare costs for sickle cell disease annually was $2 billion. These costs have huge implications for the healthcare system and the community. How does sickle cell affect our community? Philadelphia has an increased incidence of sickle cell patients due to their high population of African Americans. 44% of people living in Philadelphia are African American. In areas with increased prevalence of sickle cell disease, easily accessible and readily available resources are necessary. Education is needed for the entire community, which can be done through health fairs and support groups. Sickle cell patients need standardized and comprehensive healthcare services. Community outreach programs are available to raise awareness of the disease and educate the community. Jefferson Health has a local sickle cell disease program. Jefferson University Health System provides a comprehensive sickle cell program, which is a collaborative effort between the Division of Hematology and Internal Medicine. The program focuses on competent and compassionate long-term care. Primary goal of the program is quality of life. Preventing complications associated with sickle cell disease, hand-foot syndrome, pain, anemia, infection, acute chest syndrome, splenic sequestration, vision loss, leg ulcers, DVT, P, etc. They offer a hydroxyurea program, chelation therapy, and blood transfusion and blood exchange transfusion programs. They also provide patients and families with support and education. They offer special diagnostic lab capabilities. Jefferson Health System maintains close relations with Philadelphia/Delaware Valley chapter of the Sickle Cell Disease Association of America. The Sickle Cell Disease Association of America is a great resource center for the psychosocial and social service needs of sickle cell patients and their families. Jefferson's Sickle Cell Program provides an outpatient clinic, pain management clinic, counseling and social work services, and a 24-hour call center.